BusinessJournalDaily.com 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.
And this opportunity at NEOMED opened up, and I took a look at it. The university itself, it's really a nimble, innovative organization. It adapts to change. It's looking to do things differently, and I think we need to do things differently in healthcare. So as I explored the opportunity, met with our board of trustees and the interview committee, it became very clear to me that this was a natural fit for what I'm passionate about, and I think it's a good fit for my skill set. So I'm really interested in what we can do out here to really impact training the next generation of clinicians, improving our research quality, and of course providing service to the community.
And when you say that things need to be different in healthcare and medical services, what precisely do you mean? What are some of your goals to affect those changes through NEOMED?
So some of the problems that we have are we have an unsustainable financial model in healthcare. We all know it's really taking up a substantial part of our GDP. If it continues at its current rate, all we would do is healthcare delivery in the United States, and that can't happen. Big issues are access to care, cost of care, and making sure that there's equitable distribution to everybody who needs it. Those who are in the field now are used to the business model that we live within, and that's the reimbursement system here in the United States. It's based on a combination of billing codes that are generated by the American Medical Association and also the Center for Medicare and Medicaid Services. Private insurers tend to use those same codes, although they'll work out separate contracts. And it incentivizes us in the U.S. to pay for care delivery. How do we treat people with disease processes currently? And we're really good at that. We're number one in the world at that. What we're not as good at is the more cost-effective approach to healthcare, and that is how do we maintain and incentivize wellness? How do we prevent diseases? Because that gives you the bigger bang for the buck. It's far more cost-effective, and then we also prevent the morbidity to patients. You don't want to get sick and then get better. You'd prefer not to be sick in the first place. So to do that, we have to change the way we're training medical students and pharmacists and allied health professionals. They need to think more about not just how do we provide excellent clinical care now, but how do we prevent it? How do we really enhance wellness? And then how do we look outside the box as to how we're delivering care now in a way that's more cost effective and also provides equitable access? And it's not taught well in medical schools. In fact, most medical schools do not focus on that at all. Understanding the business of medicine is not something that's taught. And if it is, it gets a very cursory overview.
BusinessJournalDaily.com 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.